Search the Greenhouse Company Isle of Man online or call 877 951.
If it's Karcher, it has to be the island's sole appointed Karcher Sales and Service Centre.
The Mannin Line with Andy Wint.
Good afternoon, 7 minutes past 12. Government announced 111 new cases of COVID-19 yesterday. There are now 1,231 active cases, including 18 in Nobles Hospital, 2 in ICU, 246 people waiting for the result of a COVID test, and 254 people booked in for a test today. From the government vaccination dashboard, 64,943 first doses have been administered, 59,862 second doses. There are 781 people booked in over the next 7 days for a jab, and Department of Health and Social Care currently holding 11,338 shots of vaccine in stock. By a large majority, the Oxford AstraZeneca has been administered to some 60% of people. 39%, almost 40%, is the Pfizer jab, and just 2,386 shots of Moderna have been administered. We're talking to David Ashford, MHK, Department for Health and Social Care, the Minister. Of course, I must point out that David Ashford is standing in Douglas North in the forthcoming general election. His opponents thus far, the other sitting MHK, Ralph Peake, Kevin Oliphant-Smith and John Wannenberg, are standing. Good afternoon.
Good afternoon, Andy.
And good to be with you. This goes on and on and on. I'll just start with one quick question before we get to the phone lines, Mr. Ashford. Brenda just said, when is this going to end?
Well, I wish I could give Brenda a date. I mean, with the worldwide pandemic, we have to see it dampen down worldwide. It's not just here on the island or even the UK. It's what's happening elsewhere. As the World Health Organization has said, no one is safe until everyone's safe. So it really is something that can go on for quite a long time.
We know pandemics last for 4 or 5 years sometimes. I mean, do we have any handle on? Are we halfway through this thing? Are we past the worst? Where are we?
Well, you know how cautious I always like to be, Andy, and I think what we're going to see is, to be frank, we will see peaks and troughs. We will see occasions where the case numbers will come right down, and then we'll see occasions where the case numbers will peak again, and it will be like a heart graph, really, where it's up and down.
Okay, let's get to the calls now, first of all, and we've got Juan with us. You're live with the Minister for Health and Social Care, Juan.
Good afternoon, Andy. Good afternoon, David.
Good afternoon, Juan.
I'm getting in early because I want to go out and get my vitamin C in this nice bright Manx sunshine. I've got lots of questions that I've been asked to ask you. I have a lot of people that... There's a big silent majority on the island that are concerned about what's going on. And there's lots of questions, and I'm sure that Andy's going to cut me off before I get anywhere near them. But one question I want to ask you directly. Do vaccinations and jabs damage the natural immune system? And what are the long-term consequences when exposed to other infections, bacteria and diseases?
Right. The answer to that is no. It doesn't affect the long-term immune system. It doesn't affect the person's immune system. That's not how the vaccines interact. The vaccines basically train the immune system to recognise the spike protein of the virus. It is only the spike protein that it trains to recognise, and to recognise the fact that it needs to be attacked and it is an enemy to the immune system. In terms of the long-term effects, obviously there is, after any vaccine comes onto market, there continues to be studies. The effectiveness of the vaccine at the moment and the studies being shown still continues. And in terms of long-term effects, there hasn't been any high volume noticeable long-term effects identified.
So we're in a stage 3 of clinical trials at the moment. I believe in 2012, the ferrets that were used in the coronavirus trials all died. So what are they expecting the death rates to be during these clinical trials up to January 2023?
So the trials that are ongoing is the monitoring trials that are done. They don't set a death rate within the trials. The way they actually look at the trials is they examine what happens ongoing once a vaccine is out. The stage 3 trials that are required for approval of a vaccine for use have been completed the same as any other vaccine. The trials that take place now, so it gets confusing because there's 3 stages of trials. They're the ongoing monitoring trials that take place after a vaccine has gone out into the marketplace.
I just wanted to touch on the PAG meeting the other night, and I know we had some sound bites on the radio of the interaction with you and Dr. Allinson regarding the activity, and I think it wasn't helpful from both sides the way that the whole thing was put over. The situation from the other side of the hall wasn't presented properly, and I think the answers that both you give by boohooing it off as well was not really helpful. I would suggest, and I'd like to hear Andy's point on this as well, an open forum Mannin Line, maybe in the People's Hall in the Villa Marina, where yourselves, Dr. Allinson, yourself, and your health experts, that's Dr. Henrietta Hewitt and everyone, sit down on a panel with a panel of people on the other side who have their views, and let's get this out in the open, because we have got a massive amount of silent majority on this island who can't speak up for themselves and want people to speak up for themselves. Now, this is a worldwide thing. This is not just here. I mean, the protests, the thousands and thousands of people that were in the streets in Nice yesterday, and I'm sure, David, you know the protests that are going on around the world. So for you to say that this is a little pushback, I think, is a little bit undermining.
Ewan, just one quick word, though. Why do you think 59,862 people have had both vaccines on the Isle of Man?
Because they've been told to. Basically, you know what, and we've spoke through this before, Andy, there's a lot of people there, you know what the hell, I just need to travel, I want to get on with my life and I need to travel. They're taking vaccines for the wrong reason. Now, there is people there, and we've gone through this. There's people I know that are in hospital. I think even James Davis is in at the moment with COVID. And there is people that are going to struggle with it. And we're going to have to live with this. We've said this. But this testing regime that we've got out at the moment, you've got a testing pandemic. You've got half the island sitting at home, sitting on their hands, wanting to go to work. They've actually got nothing wrong with them, but they've tested positive. This is going to create a massive problem. It already is creating a massive problem in the world.
Okay, all right, David.
Well, I'm never against public meetings. I put myself forward to come forward to PAG, and I hope people recognise that I always am happy to attend public meetings. I can't speak on behalf of other people. I thought the PAG meeting the other night was a very excellent meeting. The clip that's been shared online is actually a very, very small proportion of that meeting. There were some very good questions put forward, and myself and Dr. Allinson tried to answer them as best as we could on the night.
And I appreciate that, but your health team, Dr. Hewitt and that, seem to be avoiding going to public, and I think there's a huge amount of growing disrest on the island of what's happening, and we've got a problem here with these here testing.
Okay, just one thing. I mean, just run that by me again, Ewan. So you reckon that 59,862 people have been conned into taking the vaccine? They didn't know what they were doing.
Well, you created that word there, Andy. I didn't say con, so I didn't say that. What I said was people are taking the vaccination for alternative reasons. A vaccination should be taken for your health. Now, people are taking it for their health, but there's a damned lot of people here on this island, as there is everywhere else, that are taking it because they want to get their life back and want to travel. And unfortunately, that's a fact. And if you look at the amount of people now that are taking the apps off their phones in England because there's ridiculous rhetoric that's going on. People are sitting at home. There's nothing actually wrong with them. They've just got a positive test.
Okay. All right. Well, as you say, we have to move on because lots and lots of people have sent messages in and what have you. But, Ewan, thanks for calling today. If I do say...
Look forward to the open forum.
All right, thanks for calling us today. It's quarter past 12 now. Bill dropped a note in just to say, my suggestion to David Ashford, our Health and Social Care Minister, is to follow processes adopted by Gibraltar, Jersey and Guernsey about the fact that Malta didn't accept the validity of the Manx Care vaccination certificate. Gibraltar, Jersey and Guernsey have produced a COVID vaccination documentation which is acceptable to Malta for unimpeded entry.
Well, in relation to this, having spoken to some politicians in Jersey and Guernsey, I believe they are still experiencing some issues, although it's on the list that Malta says they will accept. I believe in practicality with people entering, there have still been some issues with their particular letters. We have been in talks with the Maltese government around what we can do to make our letters acceptable. At the moment, unfortunately, what they're wanting is a secure QR code, and they're quite adamant around that. So that's a PKI, secure QR code that can only really be generated for us by the UK, which we don't currently have access to. Now, we have asked around barcodes and other items, but at the moment the Maltese government are not willing to accept that.
Okay, and how do we know? I remember we've heard you say we don't know when we're going to get access to the UK NHS app.
Well, one of the things we're talking to the UK about is the potential to have access to the secure letters, because the secure letters from the UK also contain the necessary secure QR code. So if there is any further delay on access to the physical app side of it, we've been asking, will we be able to have access to their secure letters so that our letters can be issued with a secure QR code? And those talks have been taking place this week.
Kenyon had dropped us a note from Onken. 2 questions. How many of those registered as suffering from COVID have been double jabbed with AstraZeneca? I've heard anecdotal evidence the majority of those suffering have been double jabbed with AstraZeneca. And secondly, do you have plans similar to the UK and Jersey for a booster jab in September? It said the booster will be Pfizer, as the efficacy of AstraZeneca is not seen as good.
Well, the booster, if I take the booster first of all, yes, as we've announced previously, we will be doing a booster campaign. It'll be in September. My understanding is it'll be a mix of 3 vaccines, potentially at this stage, that the UK are looking at. So it's not all Pfizer. I believe there is a mix in there. In relation to the other half of the question, in relation to how many people are double jabbed, we don't hold that information because the vaccine status of positive cases is on their personal medical records, and we can't actually obtain that without the person's permission. We can't enter someone's personal medical record.
Everybody asks time and time again, are the people in Nobles, have they been double jabbed?
And the same situation with that, we don't have access unless the patient gives permission. But one of the things I would say in relation to that, Andy, is as time moves on, we would expect that more and more patients will be double jabbed, because what the vaccine does is it suppresses the virus, so it gives you a lower risk of becoming seriously ill. It does not stop you becoming necessarily seriously ill. We know the vaccine is 94% effective. That means there's still 6% of people that are fully vaccinated that would be expected to get seriously ill. But what we are seeing is lower hospitalisation numbers.
Right.
So compared, for instance, to the outbreak in March, where we had about 800 positive cases and just over 20 patients in hospital, about 23 patients in hospital, I think it was, we've currently got 1,200 odd, and in fact at one point had nearly 2,000 cases with 20 people.
Does the efficacy of the vaccine drop off? I mean, some people had their early jabs in January and February. September's quite 7 months away.
Yeah, the studies that have been looking at this, and most of the studies that I've seen have shown that the efficacy is holding up of the vaccine. There is some slight drop-off, and I think most vaccines experience that, but it's actually not a marked drop-off. At the moment, the studies seem to be showing positivity, but of course we don't know longer term, and that's one of the reasons that this booster programme is being arranged ahead of winter.
Exactly. This is regarding, Alistair dropped the note in just to say, regarding data protection, who decides what's suitable for public information and what isn't?
So we liaise with the Information Commissioner's Office in relation to a lot of the information. The department itself, of course, also has data protection officers who are trained in what can be released under GDPR. And of course, from a legal standpoint, if we require legal clarification, we have the Attorney General's chambers that can provide that.
Do you issue the information regarding age groups of the people who've died with COVID?
Not in relation to deaths. We don't, because the low number of deaths that we have, it actually classes identifiable information. So we don't release age groups as such in terms of the deaths. In terms of deaths, when they occur, we generally just make a standard announcement because it is low numbers.
A message in now for a question for Mr. Ashford. Hi, Andy. Could you ask Mr. Ashford what are the contingency plans regarding Nobles Hospital if COVID cases keep on rising? Will all other medical procedures have to stop if this should happen?
So the outbreak plan allows for basically about 30 patients from COVID at any one time. There is obviously contingency plans then within there where we could proportion other wards. It would then have an impact on services potentially around the hospital, but we can expand the contingency. We also have the private patients unit that still isn't in use with the side rooms there that can be called in as contingency as well.
David Ashford, MHK, Minister for Health and Social Care, with us live on Mannin Line till 1 today. And Ian joins us. Hi, Ian, you're with the Minister.
Thank you very much. Good afternoon, Minister.
Good afternoon, Ian.
You mentioned before about the secure QR code that would be acceptable to Malta, and you mentioned that there was ongoing work going on at the moment. What's the timescale on this? You've given no indication of timescale. In the past, you have mentioned it will be a short number of weeks. That was some 5 weeks ago.
Yes, initially we were told that by the UK that they would hope to have us in place by the end of June. That timescale slipped with NHS Digital because they had other work they needed to complete first. They then said they would do so as soon as possible, but weren't willing to put a timescale on it. In relation to the letters, that's why we're looking at an interim solution to see if we can access their secure letters first. Because we need to have a solution where there is a secure QR code on. They are hoping to be able to do that for us in a matter of weeks, but again, they will not put a firm timescale on it. They will only do it as and when they have the capacity to do it, and that's the frustrating part of it.
So the problem is in the UK, not on the island.
Yeah. The problem is we are totally in the hands of NHS Digital and the UK government. Obviously, it's the UK government's app. They don't have to. There's no obligation on them to allow us access. So we have to work with them in order to gain that access. And the UK has kindly said we can form part of their app, but it's as and when they have the capacity to be able to set us to live.
So at the moment, you don't actually know when it's going to happen?
No, I was really optimistic and I came straight out of the gates and said what NHS Digital originally told us, which was end of June. That didn't happen, so I'm a bit cautious about putting timescales on it again at the moment. I prefer to see things in physical form before I announce anything's happening.
OK, thank you very much for your candid answer. Thank you.
23 minutes past 12, the Mannin Line today with the Minister for Health and Social Care.
For pizza, I settle for nothing less than the best. Pizza Napoli, with their wood-fired oven pizza that cooks in just 90 seconds once they've made it up. Nothing frozen, nothing microwaved. It makes me feel like I'm here in Italia, eating a delicious, authentic, tasting pizza in a cobbled square with music and...
Did you order from Pizza Napoli again?
It's free contactless delivery over £15. Call Douglas 813 100. Pizza Napoli in Ramsey and Douglas.
If you're looking for outstanding care in your own home, contact Care at Home. Our small, friendly team of professional carers are police-checked, fully trained and managed by our in-house nurse and therapists. Contact Care at Home on 23338.
Think about it. Why do we take water for granted? Is it because our beautiful island's surrounded by it? We turn on a tap and expect it to just be there. But Manx water is the only water we have, so we need to think about every precious drop and use it wisely, in our homes, in our gardens, and in general. Luckily for us, there's lots of ways to be water wise. Visit manxutilities.im to discover more.
Whether you like live music, theatre, film, or running around in circles pretending to be a superhero, you'll love Villa Gaiety. With Dragon's Castle Play Area, Broadway Cinema, Gaiety Theatre and the Villa Marina. Check out the upcoming events at villagaiety.com or call 600 555. Villa Gaiety, the island's premier entertainment venue.
The Nobles Park Fun Day is on this Saturday afternoon. And once again, the Douglas Borough Council event will offer free entertainment for all the family, including bouncy castles, rides and loads of food and drink. And the Manx Radio touring team will also be there. You can join in with our giant games and we'll also give you the chance to win a £50 voucher for Talk of the Town Bar and Grill at the Nobles Park Pavilion. So make sure you come down and say hello at the Nobles Park Fun Day this Saturday from 12 till 4, supported by your nation station, Manx Radio.
The Mannin Line with Andy Wint.
It's 25 past 12. Howard, good afternoon. You're with the Minister for Health and Social Care.
Good afternoon, Andy. Good afternoon, Minister.
Good afternoon, Howard.
Just a curio, I wasn't going to bother with the lateral flow tests, but I had one given to me yesterday, and it's one that's come from the UK. Does the same system apply to the Isle of Man as applies in the UK, where if you go into a chemist shop and ask for a lateral flow kit, they ask you how many are in your family? If there's one, you get one. And this particular one went into a shop, into a chemist shop in the UK, and they said, how many? And they said, there's 5. And they gave this particular person 5 lateral flow kits. Now, that could explain partially how they're disappearing so rapidly. Quoting your own figures of 200,000. Well, that equates to somewhere in the region of 1.4 million tests. Which is an awful lot of people for a small population. Plus, people are under the impression that these tests are free. They are free at source, but to the taxpayer, and to quote your own figures, they're costing £2.75 each. And up to date, if your figures are right, that should be somewhere just over £500,000 that's been spent on the tests. Does this system still apply here for the number of tests going out, number of kits going out? And is there any record of how many's gone to individual households?
So in relation to the LFTs, there's no record of how many have gone to individual households because we don't record who's picking them up. They're free at the point of delivery. It's 1 per person. It's limited to. Anyone can go in and get it. If you give me a perfect opportunity, though, Howard, to say there is absolutely no reason for people to be storing lateral flow tests. People only should take what they require. They do not need to be hoarding them in any way. All that's doing is preventing other people from accessing the kits. We will be looking to try and start up potentially a delivery scheme, which will mitigate some of that with delivery direct to households. But I just need to emphasise again that there is absolutely no reason for people to be trying to go around the island collecting multiple LFTs. There is absolutely no need to be storing them.
Yeah, but as I say, this one was in a large chemist. It was actually Boots in the UK, and the person behind the counter asked the person going in for an lateral flow test kit, how many's in the house? There's a similar situation here where you walk into a chemist shop or a distribution point and they say to you, how many are in your household? And you say 5, and then they give you 5 kits, which seems a bit pointless when there's 7 tests on each kit.
Yeah, I mean, like I say, it should really be one kit per person turning up, and that's why we will be doing delivery services, hopefully, that will allow us to deliver direct to the household. You know, the island is actually one of the things that's come off the back of the LFTs was it was going to go one or two ways. Either no one was going to test, or a lot of people were going to want to test. And I think, again, it shows how responsible the island community's been throughout this entire pandemic period, that we have had a large number of people taking it seriously and wanting to test themselves. But I do urge people, again, that there's absolutely no reason for them to be storing large amounts of lateral flow. That's just actually stopping other people accessing those test kits.
Yeah, as I say, that if they have to go down and purchase them, which is fair and right that they don't have to, but people are on a belief that they're free, so they are free, but they're only free at source. And as I say, up to date, just going on your own figures, around about 200,000 gone out, which equates to over £500,000.
Yeah.
And this could become a very expensive exercise if the tests continue for any period of time.
Most definitely, and that's why it is important to emphasise exactly as you've rightly said there, Howard. It may seem free to the front-end user, but there is a cost somewhere, and that cost is to the taxpayer.
OK. All right. Thanks, Howard.
Thanks, Andy. Thanks, Minister.
All right. Good to talk to you. Bill joins us now on Mannin Line. Hi, Bill. You're live with David Ashford.
Oh, hi, Andy. Hi, Minister.
Good afternoon, Bill.
I just want to ask a couple of questions about proportion and perspective. I looked it up, and there's about 850 people roughly die on the Isle of Man each year. How many people have died during the pandemic? Do you know?
During the entire period of the pandemic, I believe it's 29. I think in total. I'll give you the exact.
Yeah. sorry, what I meant was like how many. So just say, for instance, 850 people die each year anyway.
Yes.
So we say 29 have died.
25. It's 25.
25 so far, which is unfortunate. You know, it's horrible, we know. But what I'm trying to get at is, like, has it been 1,600 through the last 18 months in total? But obviously, what I'm saying is very small compared to the restrictions, the lockdown, the mental health issues. How many people have taken their own lives during the pandemic? Do we know that number? I mean, there's lots of rumours going around. I'm sure you've heard it.
So I think I don't want to put words in your mouth, but what you're asking is, have more people died during the pandemic than would have died statistically normally?
Yes.
Yeah, in terms of excess mortality, we aren't seeing that necessarily. But one of the things we've got to remember is one of the reasons we have our death rate that we do with COVID is because of the measures we took last year before there was a vaccine, because we went into lockdown. If it had gone through the population in the way it is now, without the vaccine in place, we would have expected to see a much, much higher death rate from COVID-19. Looking at experiences in the UK, we would have been seeing about 2% of all cases actually dying, which we haven't seen. But yeah, as we move into living with COVID, and now the vaccine rollout has happened, we do need to start treating COVID just like we do any other form of respiratory disease. And I think that's part of the messaging, that the vaccine is providing the most protection that society is likely ever to have from this virus. And, you know, the lockdowns were there for a period when we didn't have that protection in place.
Oh, I agree. I think that the policies that were put in place are going to incur 10 times more problems than the actual virus would have done. Just my opinion, and only time will tell.
Yeah, and I think we've always been quite honest about that in terms of, you know, the lockdowns and everything else. We always made absolutely clear, both myself and the Chief Minister and others, that we wanted to come out of them as quickly as possible because we recognised, you know, there were mental health issues off the back of that. There was anxiety issues, there was depression issues, there was issues with people being separated from their support networks, and lockdown should always be the last resort.
I mean, people in hospital giving birth with no partner, it goes on and on.
Yeah.
But also, the other thing is, everybody I know now knows the most time we've had is so many cases. Now, I know lots of people with COVID who are isolating now. I know people who've had it, old, young, children, etc. Every single person I talk to, every single one, say it's barely a cold. And that's unvaccinated and vaccinated.
Well, in relation to unvaccinated, they're very lucky in that case, I've got to be honest and say that. In terms of those that are vaccinated, the vaccine does suppress the virus. That's what it's designed to do. People will still get seriously ill from COVID, though, and as we say, the vaccine's 94% effective, so you would still expect 6% of fully vaccinated people to potentially become seriously ill. We do need to start treating it like we do other diseases now that we've got the vaccine rolled out, but we do have to respect that there are people that are at risk, and there are people who will be seriously ill from COVID, just as they are with other diseases. COVID, like I say, if you look around the world and you look at those countries that haven't managed to get the vaccine rolled out, the death toll in some of them is actually quite horrific.
OK, Bill, thanks for calling today. Let's get to Anna on Mannin Line. Hi, Anna, you're live with David Ashford.
Hello. What I'd like to ask is, how many of the positive COVID test results are being sent for genetic sequencing now? And if we get cases on the island of the South African Beta variant or the Nepal Delta Plus variant, will the public be notified about that?
Yeah, we do still send all of our testing off for genetic sequencing. We're still doing that. It basically, unsurprisingly, with the way it's gone in the UK, it is all coming back as Delta. As far as I'm aware, we haven't had any cases that in the current outbreak that haven't been Delta. But yes, we will continue to share that data if we started seeing cases emerge and spread happening in the community.
Oh, well, that's great, thank you. Because obviously, with us having to make our own choices now about risk and things like that, if the different variants come, we might choose to, be a bit more cautious and that kind of thing. We'll be told.
Yeah, and that's the thing. Going forward, there will be different variants that will emerge. The world is very different to the last time there was a worldwide pandemic like this. In the fact we can identify those variants, and it is important that if we started seeing that, we do communicate it to the public.
Well, that's great. Thank you very much.
OK, thanks, Anna. Here's a message in from John, who just said, I'd like to thank the Minister for all his hard work over the last year, keeping the island safe. But are Comin ignoring advice and sometimes protest and sometimes public opinion outcry and forcing the public to take the virus into their own hands? Because we get mixed messages about Comin ploughing their own furrow, not taking advice from people. How does that work? Who decides?
It's a mix of advice. I mean, obviously, as council and ministers, we receive clinical advice. We receive advice from the emergency advisory group that's been set up. We also have to take into account the economic circumstances of the island. We have to take into account the well-being of individuals, the public health advice as well, that sometimes can be different from the clinical advice. And we have to mush that all together as council and ministers and then come up with a decision. So, for instance, we've seen in the last couple of days the messaging around masks. Now, that isn't something new. If people go back and watch the press conferences over the last month, at every single press conference I've made the point about people should be considering wearing masks in enclosed spaces, consider ventilation. We can't state those messages enough. But this is the difficult balance now, because as we come to live with COVID, we've got to get that fine balance between government and the state saying what people should be doing and people taking it into their own hands to protect themselves where they feel that's appropriate. And different people will make different decisions. So this was always going to be the difficult phase.
That's the issue, that you may say one thing to 1,000 people and they take it 1,000 different ways. Now, when we were under emergency powers, it was easy. The government said this is going to happen, and it happened. And now Chief Minister said many times, we want to get out of your lives. We want you to get on with it. Some people like being told what to do, though, Mr. Ashford. Some people, there is the case that some people, if you give them a chance to do something, they'll make the wrong decision.
Well, I think what's important is, and that's a very good, interesting phrase there, Andy, is about the wrong decision. People need to make the decisions that are right for them. And I think when you're thinking about your decision for yourself, there's not really a wrong decision. You've got to weigh up.
But your decision may have an impact on other people.
It could, but like I say, people need to take that. So, for instance, when I'm going shopping, I'm wearing a mask. People will see me out and about in a mask because that's what I've decided to do, because I'm in an enclosed space, potentially also with poor ventilation. Others might make a different decision, but this is the difficult stage, because this is sort of the interim stage between going completely back to normal and moving away from the state dictating everything that's going to be done. And it's always going to be the most difficult phase to get through, because there are people, and you're quite right, who would be quite happy with the state telling them, laying out absolute strictures as to what must happen, as we had to do during the lockdown periods. But this is now the blended situation where we need to hand more power back to the public.
David Ashford, MHK, is with us, Minister for Health and Social Care. I must also state Mr. Ashford standing as an MHK in the forthcoming general election in Douglas North, and he'll be also standing alongside Ralph Peake, the other current sitting MHK, John Wannenberg, and also Kevin Oliphant-Smith. Sarah on the line now with David Ashford. Sarah, you're live with the Minister.
Oh, hello, Mr. Ashford. I'm just calling in respect of the conversation you just had with another resident member of the Isle of Man in respect of the QR NHS secure letters. And you mentioned that it'll be a matter of weeks, you hope. However, we have an email from you saying that you're hoping it will be within the next 10 days. This is really important to us because we leave the Isle of Man on the 29th of August to go to Malta, and we have to make arrangements. And if it's going to be weeks rather than the 10 days that you said that you hoped it would be, I appreciate that you couldn't give us 100% confirmation of this. That's going to make a big difference to us.
Yeah, I'm happy to comment on that, Sarah. Yeah, we are hoping it's 10 days, but like I say, there is absolutely no guarantee with that. I can't commit NHS Digital. We would hope that we will be able to have access to the letters in the next 10 days, but we are entirely in their hands. So like I say, we would hope that we'll be able to do secure letters by that point. But I can't give a firm guarantee. I've got to be quite honest about
immigration at Malta, at the airport in Valletta, must have joined the dots by now. Surely they know what the Isle of Man is by now.
They do, and I've spoken to my counterpart in Malta as well. But the Maltese government is absolutely adamant that they will not shift. They require the PKI QR code, and the only way we can obtain that is either via the secure letters from the UK or access to the app. We are talking with them about access to the letters, and we hope that would be in place within the next 10 days or so. But like I say, we can't absolutely guarantee that because we are entirely in the hands of the UK government.
So, Sarah, what's going to happen if you pitch up at the airport in Malta and you don't have the letters?
Well, obviously we won't be able to go, but it's going to incur charges for us now because the Maltese changed their rules on the 24th of July and made these stipulations. So it is a massive problem to us because this isn't just a holiday for us. It's a family holiday that we've all been looking for, and everybody else is in the UK and they all have access to the letters, so it causes a lot of disruption for us. But could I just ask, just on the back of what you said, Mr. Ashford, just to say to you, do you know, surely the NHS in the UK, although they won't 100% guarantee anything at the moment, they must give you a date when they will be able to tell you whether it's going to go live, so you're aware. Are you expecting that in a week or a few days, or
We will only get the date once they are ready to do it. We will get a matter of days' notice that they're ready to set us to live once all the work streams have been completed. Okay. It's at that point they will advise. But like I say, we are hopeful we'll be able to get access to the secure letters earlier. I've been in talks political talks with the Maltese government around what they will and won't accept. It's been pointed out it's unfortunate because Malta's the only real problem we've had. Other countries such as Spain, etc., people have been able to get into absolutely fine with the letters that we're providing. That has been pointed out, but they're absolutely adamant on their entry criteria.
Okay, all right. Thanks, Sarah.
Thank you.
Okay, let's go to Steve now. Hi, Steve. You're live with David Ashford.
Hi, guys. How you doing? Hi, David. You all right?
Hello, Steve.
Hey, boy. I've known you for a long time since school, so it's nice to talk to someone I know.
I had more hair back then.
Yeah, so did I. I wouldn't like your job. You've got to stand there and read what's put in front of you, or say what you're told to say in a way, or you've got to watch what you say, and you can only say so many things about this and so many things about that. At the end of the day, you're asked a question by Dewing, and I like that guy, Dewing. He had really good points. Now, no disrespect, you're not a medical expert. You don't design these jabs, and you don't go into the ins and the outs. At the end of the day, you can only say so much. But when he asked you a specific question about the immune system, I said to the other half, he'll just come out and say no, because that's all you can say. And you came out and says, no, it doesn't affect the immune system. It does such and such and such and such. That's what you've been told, David. That's what you have been made to believe. Now, let me explain before you jump in, David. Another thing that frustrates me more than that particular point was when you go to hospital and you're not well, the first thing you're going to be asked by that nurse, have you been double jabbed? And you'll give that nurse that information. Now then, we're being herded, example, maybe the wrong word, but encouraged, go and get your jab. Get your jabs. It's our defence line against this awful disease. But when we're asked, or you're asked, give us that number of how many people are struggling with this in our hospital, now taking beds up in our hospital. Oh, we can't give you that information. It's this or it's that. There's always a reason, David. You know what I'm on about. There's always a reason why and you know why, you can't disclose that. And I'll put it to you, David, you know that number. But you won't put that number out, David, on the Isle of Man. Because it proves that these jabs aren't working.
Well, categorically, I can actually say I don't have that number. I haven't. That number is not shared with me in any way, shape, or form because it hasn't been collated, because we don't have permission from all the patients to do so. In relation to the immune system, you're right. I'm not in any way a medic. I've never pretended to be a medic in any way, shape, or form. I can only go off the advice from the clinical side and public health, which is absolutely adamant that it does not have that effect. I've read a few scientific reports myself and studies where there's been accusations around issues with the vaccine and the immune system that have actually said they haven't found anything in relation to that. In terms of the actual vaccine figures that we hold, we do not hold that data. So, if Manx Care can collect that data, then we will publish it. But I can't give figures that I physically don't have access to, and I can categorically state I have not had that shared. But one thing I did say in answer to Dewan, which I actually will state again, is as more and more of the population get vaccinated, you would expect the hospital admissions to be mainly double vaccinated people, because they now make up 90% of the adult population. But what you are seeing is, if you look at the UK's hospital numbers, big population numbers, and also the same in other countries as well that have spread the vaccine, the number of people being admitted to hospital is actually lower, an awful lot lower than where it was in previous peaks.
Yeah. Okay. Well, please appreciate your views on that, David. I really do.
Okay, but Steve, sorry, it's Andy here. We're talking about trust, really. We're talking about how much people trust the decisions Komen are taken and have been taken since March of last year. Where do you stand on that?
My trust is, as I say, my general trust is with the government side of things, Andy. It's just, I can't get over the mentality of a government that we have, and it's no disrespect on David. I know it's a really hard job he does, and respect to him a long time. But I don't get when you sit around the table, David, the Chief Minister, and they're discussing let's open the island up. When you look at the health service as a general thing that can't even cope with the Manx side of things as normal, why they thought letting COVID to here at this time, anyway, at this particular time, was a great idea. It's a bad idea.
The reason for that was we actually stuck to what we said for a long time, which was, he said the key priority before we would open anything up was in relation to ensuring that the vulnerable categories to COVID, so those over 50 and with underlying health conditions, had received double vaccination. It was at that point we did make the decision to change things, and we have done it in stages. So there is still restrictions on people who are unvaccinated in terms of who can enter the island if they're not a resident. There is still test to release pathways in place as well, but this is always going to be the most difficult part, because the question is, if we don't start living with COVID now, when do we? The vaccination programme is now pretty much coming to an end. That's the maximum protection society is ever going to have. Do we not open up until the boosters are done? Do we not open up until there's absolutely no wave whatsoever, be that a year, 18 months' time? This is the difficult decisions, and I would love as Minister for Health and Social Care to have a crystal ball and be able to see what the outcomes of various different things would be. We don't have that, and this is the most difficult stage where we have to come to terms with the virus. But quite frankly, we don't know until we try something what the effect will be.
Okay, all right. Thanks, Steve.
Thanks, dude. Thank you.
Good to talk to you. 12 minutes before 1.
Welcome to the Miller Chaps of Ramsey Summer Sale, where you'll find fabulous reductions throughout the store. From beds and flooring to sofas, cane furniture and accessories, rugs, pictures, mirrors and even wallpapers. Plus, the friendly Miller Chaps team are here as always with a warm welcome and expert help and advice when needed. Don't miss the Miller Chaps of Ramsey Summer Sale. Now on.
Creating a home where you'll love to be. Millie Chaps of Ramsey.
The world's greatest sporting event finally takes place this summer. It's the RNLI All-Ireland Beach Tug of War. This Sunday from 3 at Chapel Beach, Portsamerry. See 16 teams of finely honed warriors and warrioresses do battle. With food and drink, face painting, bouncy castle, competitions and more. An amazing day out for all. Search RNLI Tug of War now for details. Supported by Island Aggregates and your nation station, Manx Radio.
Registration is now open for the Buchan School and King William's College. Come and discover how your child can enjoy the perfect start at the Buchan, and then benefit from academic excellence to achieve their full potential at King William's College. With average class sizes of 13, superb extracurricular activities and individual support, it's an outstanding island education for your child's global future. So call 820-110 to arrange your visit.
We all need to make positive personal choices to beat COVID. The risk of infection increases in close contact, confined and crowded settings. When you're out, think hands, face, space and fresh air. Visit covid19.gov.im. Make the right decisions. Be safe, be smart, be kind.
The Mannin Line with Andy Wint.
And the Minister for Health and Social Care, David Ashford, MHK, is with us. An email came in and said, Mr. Ashford, why are we using Aintree Hospital across, which has been making headlines for all the wrong reasons regarding care?
Aintree is one of our feeder hospitals. It's not the sole one, where we use Aintree for very specific procedures. We use Liverpool Royal for others, and we use Wrightington, of course, in the northwest as well. So it's not, and obviously as well, we use Clatterbridge for cancer treatment. So it's not our sole provider, but it is one of them. The issues that are being identified and making headlines with Aintree were issues from 2018. Since then, of course, there's been the merger with the Royal Liverpool Hospital, with the Royal in 2019, which has been trying to correct it. I believe there's a letter from doctors that has come to light recently to the board about concerns. But this is one of the reasons that there was that merger between Liverpool Royal and Aintree, was to actually try and sort out the problems that have been there for about 3 years.
OK, just a quick one before we get back to the lines. When cancer referrals became a concern in March of last year, Manx Breast Cancer and another charity offered to fund an oncologist, but DHSC turned it down. There are delays now, which means the 2-week urgent breast cancer referral is now 8 weeks by January of this year.
Yeah, there has been issues, but most of those issues have been exacerbated during the lockdown. The funding of one oncologist would not have resolved that issue because there needs to be care pathways, etc., put in place for patients. We've been working with the breast cancer charity, who has worked, exceptionally hard. Their real passion in this area to ensure that we can get patient care. We've made announcements in the last couple of weeks. Manx Care has that we are going to be referring patients into the UK, so they'll be able to be seen quicker, and we've got those pathways set up. The UK has also seen breaches of their targets in relation to the 2-week wait over the pandemic period, but we are now getting referrals into the UK system that will actually help bring that down.
OK, let's go to Peter now. You're live with David Ashford. Hello, Peter.
Hello, Minister.
Hello, Peter.
What I was wondering was, nobody seems to ask the question, could you disclose the average age of people that's hospitalised and also infected people? What's the average age group?
Well, in terms of the age groups for infected people, people will find that on the dashboard. I think it's about slide 4 or 5, where you can actually see the breakdown of the ages for the infection. In terms of hospital admissions, my understanding is that it's across various age groups, so there isn't one specific age group that the hospital admissions are falling into. It's people in their 40s, their 50s, their 60s, or even their 80s. It's a mixed bag across the different patients.
So it's not really any younger people than 40-year-olds, then, no?
I believe there is a couple, I think, that are younger than 40, but like I say, it's not something that's collated daily for me. But I believe there is. It's across all age ranges.
And does the same apply to the infected people as well, right? Yeah.
So in terms of infected, like I say, people, you'll find that on the COVID dashboard online, where you will actually see the breakdown by age range and also by male and female across the different age bands as to where the infection actually lies.
OK, why do you ask, Peter?
Because I don't hear these different stories. That it's mostly younger people that's contracting it. And then you find out that really isn't mostly younger people, because it's over 40s anyway in the hospital, isn't it?
Well, what you would tend to find is actually during an outbreak, it starts off in the younger people and then it spreads up the age ranges. So, for instance, if you look at the outbreak early on that we've just had, the vast majority of those cases were in young people. They were contracted, obviously, in school-age children. But then what happens is they go home and it spreads up the age ranges. So it differs as an outbreak goes on, and we saw similar in February and March as well.
OK, thanks, Peter.
OK, thank you.
Really good to talk to you. And Julian with us now on Mannin Line. Hello, Julian.
Oh, hello there. Just wanted to ask if there's been any interest in the National Institutes of Health in America. There's been research from the Fred Hutchinson Cancer Center in Seattle and the Emory University in Atlanta, Georgia. And the title, it's a little bit of a tongue twister, but as soon as you start putting in a couple of words into a Google search, it immediately comes up with a suggestion. And the title is called Longitudinal analysis shows durable and broad immune memory after SARS-CoV-2 infection with persisting antibody responses and memory B and T cells.
Okay, Julian, you've got a minute left if you could cut to the chase.
Yeah, sure. So basically what they found is at 250 days, 254 patients have shown full immunity to SARS-CoV-2 and, interestingly, to SARS-CoV-1 as well. This is going on between now and, well, it's been 8 months and it's going on till February 2023, age range 18 to 42. And it was reported on June the 18th that they were finding robust and durable immunity to SARS-CoV-2 in all of them. And that was 254 patients, which they're monitoring until 2023.
Well, I'll be honest, I haven't seen that, but you've given me the title. And in fact, while we were speaking there, I was just typing it into Google. So I'll take a look at it and I'll pass it on to Public Health.
Okay, thanks, Julian. Just one final question we get to. We're out of time now, Minister. When are the residential homes opening up?
So the residential homes, it was a 10-day fire break. I can't remember how many days we're into that now. But in terms of visitors, it will be up to the individual homes. I have to stress that. Each of the homes has a infection control policy in place, and it will be up to them to ensure what visitor policies they believe are appropriate for their residents. Okay,
we're out of time now, but if you want to get in touch out of hours, you can get in touch via Mannin Line at manxradio.com. You can call the answer phone on 682 631. I just want to go back to the fact that people continually keep on about government hiding behind GDPR and data protection. What's the official word?
So we don't. What we can release, what was being advised, we can release. We do release.
Okay, thanks for being with us today. And just one final question, and it's just regarding Comin. All Comin members on the page with this, by the way?
Comin comes to a agreement, and Comin has agreed the measures in place.
Okay, thanks for being with us today. Good to talk to you, Mr. Ashford. Thank you. David Ashford, MHK, has been with us on Mannin Line today. I mentioned he is standing in Douglas North in September. He'll be facing Kevin Oliphant-Smith, Ralph Peake and John Wannenberg. You can hear this programme again as a podcast next Wednesday, by the way, a week tomorrow. Or is it next Tuesday? Oh, it's next Tuesday. The president of Tim will be on Mannin Line, the Honourable Lawrence Kelly. I want to thank Barry Redfern producing today. I'm Andy Wint. Back with Mannin Line tomorrow at high noon.
You see us at Festival.